Welcome back to This Week. Time now to get the views of our media and political experts, Democratic State Representative Brenda Gilmore and Syndicated conservative talk show host Steve Gill. Welcome, and it's been a couple of weeks. Nice to see everybody back again.
Welcome back. Thank you. Welcome
been
back
a busy week. The president really in a full-court press mode this week on health care reform. He's had a town hall meeting. He spoke to the nation in a news conference. He says we got a plan that he wants to have passed, and yet if you look at poll numbers, if you look at the people in Congress, there's still a lot of questions, Americans even backing off a little bit on the poll numbers. Where does this go? We know now that it's going to be delayed until at least September before any kind of vote happens.
Well, I think that's a good thing because it gives people time to actually read and digest what's actually in the bill. Might even give the president an opportunity to read the bill. He was doing an interview with bloggers this week, and when asked what was on page 16 of that particular bill, which details that you will not have a choice of private insurance available after this bill goes into effect, the president acknowledged that he's really not familiar with what's in the bill. I think he needs to be familiar with what he's saying we need to vote on right now, and maybe after August he'll have a chance to get around to that.
Well, I think August was probably an artificial date, and most of us would rather see something approved than rushed in. The president has shared with the public, and I'm very glad that he's going around to the town hall meetings. This is a very complicated issue, but when you think about 47 million people being uninsured, I think it's almost a mandate that we approve something in this United States. $1 out of every $6 going now to health care, and it's the general opinion of the experts that because insurance plays such an important part of our economy, that the economy cannot move forward until we get a handle on our insurance.
I think part of the problem, though, is the $47 million figure that Representative Gilmore cites is just inaccurate. The president cited in his press conference earlier this week there are 47 million Americans without health insurance. That's not true. The Census Bureau itself uses a 45 million figure. Then they reduce that number because there are nearly 10 million illegals in that figure. Illegals may not have health insurance, but they are not Americans without health insurance. So you're starting at about 35 million, not 47 million, and then 9 million of those, according to the Census Bureau, are people who make over $75,000 a year who have the ability to buy and get access to health insurance, who choose to buy something else with their money. So we don't need to break the entire system and go to a British system for 25 million people who right now don't have health insurance who are Americans.
Is this fight different than what happened in 93 and 94? That year, it seemed like it was more of a partisan fight. This seems to be, both sides of the aisle agree that something has to be done. It's just a question of details. This fight a little bit different?
Well, I think both sides of the aisle do agree that something has to be done. I just hope that we don't let this become a partisan fight and that we let other things get in the way of us actually doing something. When I hear the argument that we're rushing through this debate, then I find that hard to believe when we've been talking about insurance probably for over 40 or 50 years, since what I hear is since President Truman, that we've been talking about changing insurance. So I hope it doesn't become partisan, that we have both Republicans as well as Democrats that will embrace it. And it was a pretty strong mandate when President Obama got elected that this was one of his central pieces of his platform. So I'd like to see us move forward.
But the devil's always in the details. It's not just whether we should reform health care. Everybody agrees on that. The question is, what do you put in that reform? President Obama wants to absolutely exclude any and all tort reform. Frivolous lawsuits clearly have as much to do with the cost in health care as the frivolous tonsillectomies that he was citing in his health care plan. We need to deal with all the issues, not just play partisan politics.
And what I heard when he was talking to the people a few nights ago was that the tax or the surcharge, whatever we want to call it, would only be on those who are making $1 million or more.
Which is a change.
Yes. And that the cost that we would receive or save from redoing or relooking at the insurance cost would be used to offset the new programs.
That's the question. It's roughly $1 trillion program to implement. The president has said this will not increase the deficit, and he says he won't sign anything that does not reduce health care costs. Is there really enough fat, enough waste in the system to pay for a new $1 trillion program? He says there is.
Well, Congressman Cooper cited that there's $700 billion in savings.
Right.
But he kind of glossed over the fact that this thing's going to cost more than $1 trillion. He claims that we can save it with waste, fraud, and abuse cutting, but his own figures fall almost $400 billion short. And unfortunately, that $1 million surcharge on income tax on millionaires actually starts on people making $250,000 a year. Now, Brenda and the Democrats may feel that we ought to punish people making $250,000 a year to give free health care to illegal aliens, but it's still not $1 million when you make $250,000.
I don't think we should punish anyone, but I do know I retired in 2006. When I left a very prominent company here in Nashville, Vanderbilt. And for a moment there was a little anxiety even on my part about making sure that I would have insurance to carry me out in the future. We have people in this United States of America, one of the most well-developed, most prominent countries in the whole world, and yet we are not leading in insurance. We have people who probably go to bed every night with fear that they're going to get sick and not have some insurance to cover it. And I think that that's really kind of sinful when we are advanced and we have as much knowledge and we can fix this problem if we just come together and not let it become a partisan issue.
The question is whether we should lead in insurance or lead in health care. The reason we have people coming to our country from Britain and from Canada where they have free health care is because while they've got insurance, they don't have good quality health care. They come here because our health care is better. I think we ought to stay focused on health care, not insurance and not free care.
Does the president have to convince his own party of this first? The Democrats have control of Congress, and yet there are factions within the Democratic Party that have serious issues with this. If they vote no or they stay away, this will not pass, and the Republicans can do whatever they want to do. The Democrats could kill it.
I'd like to see the Democrats come to the party. I think that they're perfectly in their right to ask these questions, and that's why I'm glad that we are not rushing it through. I do hope we have something approved by at least the end of fall, and I'd like to see the Democrats get on board. The president needs their loyalty, and he needs some Republicans to approve this bill also.
I'd like to see him approve the right thing, regardless of when they do it. And even Democrat Governor Phil Bredesen, as Marsha Blackburn noted, said this is not a good idea.
Scandal on Tennessee's Capitol Hill this week with State Senator Paul Stanley admitting to an extortion scam against him, admitting to an affair with an intern, and some other senators, some other folks in the House and Senate saying maybe they need to rewrite concerns and rewrite rules of how to deal with interns. We really need to write rules, don't have sex with interns. I mean, this is really kind of a travesty going on down there.
Well, I'm sorry that anytime anything negative happens in our Tennessee General Assembly, because I think it sends up a red flag.
Sure.
Already the public, I think, has some trust issues with us as legislators, so I'd like to see us do everything that we can to maintain that trust. And so for that reason, I deeply regret that this has happened for the intern, the young lady, as well as for Senator Stanley and his family.
I think it's a shame, but I think I agree with you that rewriting the rules, is there anybody up on Capitol Hill that's really confused on whether you mess with the help? I mean, that's ridiculous. They ought to know better than that, and they ought to act the way their mamas and daddies taught them.
Steve Gill, Brenda Gilmore, appreciate very much your insight, and stay with us. This Week continues in a moment.